Tonight, concerns are mounting by the minute as COVID cases grow in our state. Right now, more than 1,700 people are hospitalized with the virus. Nearly 30% of those people are in the ICU. About 40 children are in the hospital with the virus. And you need to hear this. Just 1 month ago, only about 230 people were hospitalized with COVID. That's an increase of over 639%. All of this is creating a domino of negative effects on hospitals and the capacity of care they can provide to those who need it. News 4's Tosin Fakile joins us live. So, Tosin, you talked to a physician. Give us an idea of how much of an impact this new surge in COVID cases is having.
Well, Marius, here's what he told me. A critical care doctor I spoke to said just a couple months ago in one of the hospitals he works in, there were absolutely no COVID-19 patients in the hospital, and he counted that a victory. He says right now, that's no longer the case.
One of the hospitals I work at, 20% of the patients in the hospital have COVID-19 right now.
And that fact, doctors say, affects care for other people with other medical issues.
If you have a heart attack or a stroke or another medical condition that is surprising and sneaks up on you, we want to have a place to take care of you. And that's getting increasingly difficult, especially in our rural satellite hospitals.
Tennessee added about 4,000 new COVID cases on Sunday, putting the state at over 914,000 COVID-19 cases.
It's concerning, and people on the front lines I know are overwhelmed and are scared about this because it's real. So yeah, it does scare me.
I would hate to go back on lockdown, but if it keeps going the way it's going at this point, I feel like that the lockdown is going to be necessary again.
I can remember taking some of my PPE and packing it up and like taping up a box, and to have to now open that container again, get that gear back out and start taking care of folks with critical illness who now have a preventable disease. It's heart-wrenching.
Doctors say this wave of COVID-19 patients are younger and more sick.
Just last week, I was trying to find an ECMO circuit, which is a type of salvage therapy for patients with respiratory failure for a young patient with COVID. And I was looking as far as Ohio to find a bed for that patient.
And this increase in COVID cases isn't just affecting where you go to get care, it's affecting those giving the care.
We are accustomed to seeing death in the line of in our jobs, but not this much. And now the death is so preventable, which just adds to the tragedy. And so we are tired, we are broken, and so we want to do anything we can as physicians to get the truth out. And the truth is that there's a lot we can do to help each other. We can wear masks, we can get vaccinated. We know the vaccine is safe and effective, and it's our best path towards beating COVID-19.
Now, Dr. Martin, who you just heard from, says he knows people talk about the COVID-19 vaccine not having full FDA approval, or he says he wants to remind people that the technology for COVID-19, Marius, has been around for decades. And he says if people want to understand how doctors really feel about the COVID-19 vaccine, he says over 95% of doctors in this community have been vaccinated. Back to you.